It's a brand new year, and with that, we've got a brand new specialist joining the Melomed family. In fact, he's the only gynaecologist. Dr. Sedick Camroodien, welcome to Melo TV.
Thank you, Gershwin. Lovely to be here.
Born and bred in Cape Town, a real salt of the earth person, but you have a big interest in complex obstetrics and high-risk pregnancies.
Yeah, correct. I think I was quite fortunate enough during my 4-year obstetrics and gynecology training to spend quite a few months in the high-risk setting. And so I enjoy your preeclamptic patients, your twin pregnancies, and any medical conditions associated with pregnancy. I just like looking after women with complexities, but it gives me great joy, and to have a positive outcome at the end of that, I think that feeling is just very rewarding, to offer your best and ultimately have a healthy and happy mom and baby at the end of the whole process.
That is so important, because once you're here, you're pregnant, the nerves set in, and all you want is a healthy bundle of joy.
Correct, yeah, and not to say that I don't accept uncomplicated pregnancies. Please, if you need an obstetrician, come see me. But if you're known with any complexities or past medical problems associated with your pregnancy, make an appointment to come see me, and we'll take it from there.
Dr. Sedick Camroodien is our guest right here on Melo TV. Let's talk about cervical cancer. It's one of those cancers that you don't hear a lot of noise about, but it affects so many women.
Yes, I mean, it makes me think of breast cancer. People know all about breast cancer, and it's unfortunate. I look around social media, nothing's mentioned about cervical cancer, and yet it is the most common gynecological cancer, not just in South Africa, but globally. And I think more needs to be spoken about cervical cancer, and focusing on primary prevention as well as secondary prevention. Primary prevention, taking your daughters for the cervical vaccine, and if you're already sexually active, we then talk about secondary prevention, which is your screening with your very old form of screening, which is the pap smear. It has evolved now. We can test directly for the culprit, being HPV virus that ultimately causes cervical cancer. So we can test for that specifically on the same pap smear that our general population are aware about as a screening tool for cervical cancer.
Let's quickly talk about cervical cancer. Someone says or asks, what is cervical cancer? Cervix cancer, your subspecialty is gynecological oncology.
Yes, so I think a lot of people know about the womb, because they know pregnancy happens within the womb. Everybody knows the vagina. So the cervix sits between the womb and the vagina. Very importantly, why the cervix is susceptible to contract the virus. It's got a very important part called the transformation zone between the inner part and outer part of the mouth of the womb. That's where the cells replicate. And the virus very cleverly has detected that weakness in that area.
So it hides.
So it impregnates there, and it integrates into the host immune system via that transformation zone, and that's where it sits. And it persists, and that's where the cancer develops from, in the mouth of the womb.
Let's talk about the symptoms. What are the symptoms when you start thinking, I need to go see my gynae, I need to see my obstetrician?
Yeah, so I think initially, and that's the problem, I think, as to why we're not seeing people coming readily for screening. Early stage cervical cancer, you might have no symptoms. And as the disease progresses, the most common symptom would be abnormal bleeding, a watery discharge, a foul-smelling discharge, persistent lower abdominal pain, and the likes. Then it's already probably late stage 1, stage 2 disease. And then if you have more severe symptoms like shortness of breath, it means it might have spread to the lung already. Back pain, that means advanced disease. It might have already spread to the bone, the spine. And then, so we want to avoid that. So, and that's where coming to your gynecologist annually, every 2 years, every 3 years. I don't want to confuse the listeners, but make a start by seeing your gynae. Let them give you the results of your pap smear, and that can determine how frequently they need to see you again after that.
Our guest is Dr. Sedick Camroodien, a gynaecologist within the Melomed group, the only one in the Melomed group. There is this fear element, the unknown element, that people don't want to go because they don't want to know what happens if I have cervical cancer or ovarian cancer or womb cancer. But your body is talking to you.
Yeah. So I don't know what it is, why patients don't want to come for screening. I think partly my understanding over the 2 years, people don't want to know, the anxiety. They might fear the intimate or the invasive investigation in the form of a pap smear. You know, it's patient's dignity. They're shy, especially maybe coming to a male gynecologist, or they don't know about the disease. I don't think enough is being spoken about. But it makes me think about the most common lung infection in the Western Cape is TB. So how do you look for TB? You go for a chest x-ray. Yeah, I'm telling you, if you have abnormal bleeding, it's coming from the mouth of the womb or from the ovaries. So what do you need? You need a pap smear. You need a sample from your endometrial lining. You need a gynae ultrasound to look at your ovaries. So the same principle applies, but it just takes the effort from the patient to seek medical advice, and the clinician will do the necessary, well, at least that's the bare minimum you will expect from me or you will receive from me. I'll do a thorough gynae exam, ultrasound, which is a gynae ultrasound, a pap smear, and if warranted, an endometrial sample. And I can give you your results or your clean bill of health, hopefully in a couple of days. And if all's normal, you can see me in another year's time.
Dr. Sedick Camroodien, thank you so much for joining us right here on Melo TV, and thank you so much for your insight, especially when it comes to obstetrics and gynaecology.
Yes, thank you, Gershwin, for having me here. It was my absolute pleasure. I realized very quickly how little people know about my subspeciality, and it's just my pleasure to educate the greater population. And it's ultimately all about getting that screening in so we can catch the disease before it's too late.
Dr. Sedick Camroodien right here on Melo TV. His contact details is on the screen. As always, take care of yourself and take care of your loved ones. Until next time, goodbye.